Hi, everyone. My name is Dr. Esther Feldman, and I'm speaking to you from Los Angeles, California, and I'm going to talk about acceleration tools for predictable tooth movement. I want to thank you all for joining me today. I'm sure you took time out of your very busy schedules since we're all homebound during these unprecedented times. I also wanted to let you guys know that you can type in your questions in the question tab, and I'll review all of those at the end of the presentation. All right, without further ado. So we have two slides that I have to go over. So this is a disclaimer. I have been compensated in the past for consulting and or evaluating products for the sponsor, including Propel Orthodontics. For my participation in this event, I have received an honorarium from Propel Orthodontics. The opinions expressed in this presentation are my views and may not necessarily reflect the views or policies of the sponsor. The materials provided are for educational use and not to be used for advertising or product endorsement purposes. This presentation has been approved for continuing education credits, so long as you guys registered. No photographs, video, or audio recordings are permitted during this presentation. And my disclosure, I am not employed by any dental company. I do not own stock, securities, or interest in any dental company. A family member, whether immediate or extended, is not employed by or owns any stock, securities, or interest in any dental company. And I have consulted or evaluated products for some organizations, including Propel Orthodontics. So a little bit about me. I'm originally from Montreal, Quebec, Canada. I am perfectly bilingual. I speak both English and French. I spent 7 years at McGill University. I completed my bachelor's in science in anatomy and cell biology, and then did my doctor of dental medicine there. I did not do a residency. I went straight to University of British Columbia in Vancouver and completed my diploma in orthodontics and got a master's in craniofacial science. Once I was on the West Coast, I stayed on the West Coast and I moved out to Los Angeles, where I became a diplomat of the American Board of Orthodontics. And I also finished my Royal College of Dentists. So I'm board certified both in Canada and in the US. I opened my practice in LA in 2015. And I also had my master's thesis article published in the American Journal of Orthodontics in 2015. So my practice is pretty unique for an orthodontic office. I only have 3 chairs, so it's a small boutique office. It's in West Los Angeles in an area called Brentwood, which is quite an affluent, high education area. So I have 3 chairs and 3 staff. I'm a fee-for-service office. I don't accept assignments from dental insurance companies, but I do submit claims for my patients. It's a very personalized office. All my patients have access to me, and most of them come to me because they want that doctor time. They want that service. So these are 2 of my staff, and that's the team. And you can see in the back, these are my famous Invisalign Jello shots that were quite a hit at my open house party, which was 3 years ago. And we're going to jump in. So just to give you a bit of a layout for the presentation, we're really going to focus on acceleration through vibration, the vPro 5 accelerating device. But I wanted to review Micro-Osteoperforation MOPs, which is another product from Propel that I often use in conjunction with my vPro cases. So we'll touch on a little bit of the science. So bone remodeling, which we know is a continuous process. The bone turns over in our bodies, and it really does depend on someone's metabolism. So every individual has a different rate of bone remodeling, and it's affected by age, it's affected by medications that someone might be on, systemic conditions. So when patients ask us how long their treatment's going to be, we always give them a range. We always give them an estimate, because there are so many factors that are going to affect their metabolism and their bone remodeling rate, which is in effect going to affect their tooth movement, their rate of tooth movement. So as you can see on the bottom with the pictorial, the different phases of bone metabolism. The osteoclasts come in and they resorb the bone. Then there's the reversal phase, and the osteoblasts will put down the lining cells. So it's constantly happening. And the way MOPs, or micro-osteoperforations, work is by stimulating the bone, we're changing the metabolism. We're creating this regional acceleratory phenomenon that's going to create an inflammatory response, fast healing, and that effect will create about 60 to 70% faster tooth movement. So MOPs targets the rate of remodeling directly. So what it does is it creates this very localized inflammation. We'll get increased cytokine levels. We'll get a temporary decrease in bone density to allow the teeth to move faster through that bone. We get an increased rate of bone remodeling by ways of the healing response. And thereby we get an increased rate of tooth movement through the bone. So I'm not going to focus too much on the science, but it's always nice to know that it was studied and it was proven. So a randomized control trial done in 2018 showed that MOP significantly accelerated tooth movement, that it was effective, it was well tolerated, and it was safe. These are key words to use with patients. They want to know that it's safe. They want to know that it's proven. When you tell them that you're going to be stimulating their bone with a drill, you want to really focus on the words that are important, that really tell what the procedure is doing. And it's always nice to tell them that it's going to make the treatment go by much faster, and it's going to make difficult movements much more predictable. So these are the devices that we use to do MOPs. So on the left-hand side, the manual driver, which I don't even own anymore, it's one that requires a lot more force because you're doing it all by hand. I'm going to focus more on the motorized version on the right-hand side. So really important, it's FDA approved for micro-osteoperforations. It does not fracture. It's made out of a high-grade surgical steel, so you don't have to worry about the tip fracturing when you engage it. It's autoclavable. Because it has a contra angle, it's really easy to use in the posterior and the harder to access areas. And you can adjust your RPM, your torque, and it has a little reversal button that, because you go in at one rate and then you take it out when you push the reverse button. And it does make it go much faster with the motorized version. I could do the whole mouth in about 30 minutes, I would say. So it is the gold standard. You can use it for any type of aligner, any type of orthodontic appliance, any type of movement that you're trying to achieve. It's not limited to any specific malocclusion. So it can be done for class 1, class 2, class 3, mild crowding, moderate crowding, it doesn't matter. And you can use it anytime within treatment. So if a patient decides midway through treatment that, you know, they're getting married or they need to be done by a certain time, they're moving, it's one option to make things go a lot faster. It's not compliance-based since it's all done within the office by the doctor. More predictable movement is the biggest advantage. You also don't have to do the full mouth. You decide where you want to do it. You can do it in one quad, two quads, one between, you know, one specific tooth that needs a lot of torque. A huge advantage is that it's root protective. So because it's temporarily reducing the density of the bone, it makes the roots work less hard to traverse the bone to get the movement that we need. The root resorption is one of the less desirable side effects of orthodontic tooth movement, and anything that can be root protective, especially in a case where you already have some root resorption. If you're retreating a patient who had braces when they were younger, and now they're in their 30s or 40s or 50s or 60s, and they've already had some root resorption, and you're going to treat them with Invisalign for minor relapse or moderate relapse, this is a nice tool because you know that you're protecting the roots. You're also, the teeth are working less hard to move through the teeth, so the pain is usually less, and you get to the end much faster. So a better finish, much faster. So a little bit about the procedure. It's quite simple. So first thing I do when the patient comes to my office for the Propel procedure is sign the consent form. Then I have the pan or the full mouth series up, and we evaluate the treatment area. So we'll palpate between the roots. You always want to double check. You do not want to hit any of the roots. Patients will rinse with chlorhexidine for 2 minutes prior to the procedure. And then we get right into it. We anesthetize. I usually do 1 arch at a time if I'm doing the full mouth. And then we treat the areas that are required to be treated. So something really important and a common misconception with MOPs is that you're not just creating a hole. You're not just piercing the bone and the soft tissue to get that response. What you're actually doing is when that tip engages the bone, it's creating these little microfractures. And those little microfractures, when those are healing, that's what's actually changing the bone chemistry. And that's what's creating those little stresses through the cortical bone are what create that reduction in bone density and that healing response. So some things to know about MOPs. It's totally a regional effect. So it's going to be localized. When you say it's a pro-inflammatory effect, it really is only where you're doing it. I do about 1 to 3 MOPs per site that I want to stimulate. So canines are typically hard teeth to move. So I definitely will want about 3 different stimulation points, mesial and distal to the canines, molars, teeth that are harder to move. In the anterior mandible, we have a lot less space, but the roots are just, there's more root proximity. I tend to do 1, sometimes 2. Again, it's case dependent. And the depth is typically pretty shallow. It's about 3 millimeters through cortical bone. So you're not going really, really deep through this. So in my office, I typically present MOPs to 80% of my adult patients. I'll always gauge them. If, most of them are pressed for time, most of them are young professionals or busy moms and dads that want to get their treatment done as soon as possible. So I will, if they're not too anxious or, seem like a good candidate, I will talk to them about this procedure, especially if there are some difficult tooth movements to be done. So when I present it, again, my office, I tend to have more of a highly educated, affluent population. I do charge extra for MOPs. And what's really important is to set expectations. It is a minimally invasive procedure, but it is something that when you talk to a patient about it, it sounds a little bit scary. I like to compare it to acupuncture, but I tell them that we're doing that intraorally. I really, and I will emphasize that sometimes it has to be done again. I've never repeated the full mouth, but a difficult tooth, again, lower canines, if you're trying to close a big space, it's trying to upright a tooth, you might have to repeat it in about 4 months' time. And then we repeat that minor discomfort. It's just it's the anesthetic that really does bother them more than the actual MOPs procedure. And I focus on the positive, 60 to 70% faster treatment. They'll be changing their aligners every 3 days, not every week or 10 days or 2 weeks, depending on your personal Invisalign or aligner schedule. So some catchphrases. So I did treat my 63-year-old mom and my husband with MOPs. So telling patients that I did it to 2 people I obviously love very dearly always helps. I use less than 1 carpule for the full mouth. It's really just small little infiltrations. You don't need them to be numb for long because the procedure is so quick. And again, I do 1 arch at a time. So I would say maybe half a carpule each arch, maybe a little less. It's really, really little. There's no downtime. So I tell patients as soon as they're not numb anymore and the anesthetic is gone, they can go ahead and eat. There's no risk. Tylenol is more than sufficient for any of the soreness, which really is temporary. I always follow up and call my patients the night after this procedure just to check in on them. No one has ever complained that the Tylenol wasn't enough. It's a more predictable and seamless treatment. And then my aligner schedule for these patients starts at 3 days for the first 6 weeks, then 4 days for the following 6 weeks, and 5 days after that. And they tend to stick to a 5-day schedule afterwards. So this is a time-lapse video in my office. I'm going to show you this patient's case actually later. But it really is quick. Sometimes you do have to top them up because you don't want them to feel anything. So I did renumb him in certain areas. But again, 30 minutes, all 4 quadrants done. And this patient, you know, by the time he left my office, he was not bleeding. That's also the advantage of using local anesthetic versus BTT, which is a strong topical, is the epi will cause less bleeding, which is a really nice thing. You don't want patients leaving with blood in their aligners. So it's really minimally invasive, and the patients leave, they're pretty happy. They're not in a lot of pain at all. And you just explain it's a mild soreness from all of those stimulations. So this is what it looks like 30 minutes after MOPs. So if you focus really carefully where those little arrows are, you can see the tiny little punctures, but that's 30 minutes later. There's no bleeding. They healed really, really nicely. It's not an aesthetic issue. And post-treatment, really important to tell patients not to take any NSAIDs, no anti-inflammatories to counteract all of the hard work that we just did. And we explained they might feel sore for the next 48 hours. I haven't had anyone have soreness longer than that. And Tylenol Extra Strength is more than adequate to treat any of that tenderness and soreness. So here's a case. So this is a 29-year-old female who came in. This is a difficult case, but what I really want to focus on is I did the MOPs later on in treatment. So the patient came in, she's severely crowded on her upper arch, mild crowding on the lower arch, and she's mildly class 2, both right and left sides. So these are her orthodontic records. If you look at her panoramic X-ray and you look at the upper first molars, you can see that those endos don't look too great. There's a periapical lesion on the upper left first molar. And when I decided that I had to extract 2 teeth on her, I didn't want to take out healthy premolars, so I actually elected to take out the questionable prognosis teeth, which were the upper first molars. So because of the poor prognosis on those teeth, the crowns had overhangs. She was symptomatic on one of them. We decided to take out the molars and leave her with a better overall oral health situation. So this is 16 months into treatment, and I had 12 millimeter spaces, both on the right and left side on the upper to close from those molar extractions. So I was protracting the upper second molars, which are big teeth, to close a big space. And 16 months into treatment, she said, okay, how much longer? She was starting to burn out. So I told her about Propel, about MOPs, and I said, this is something we can do to help close the space and it will go much faster. And she said, absolutely, sign me up. So 16 months into treatment, we decided to do the MOPs. And this is my favorite slide because this really shows you the power of what MOPs can do. So the teeth were moving so quickly that the tissue could not keep up with the tooth movement. And you can see that the tissue is bunching. So I actually had to send her to the periodontist to excise the tissue so that we can continue closing the space. And about 6 months later, at 22 months, the spaces were closed and she was finished. Class 1 canines right and left, and a 12 millimeter space both on the upper right and left was closed. And you can see I have permanent retainers, little wires on the palatal of those teeth just to maintain that space closure. So quite a dramatic change from start to finish. I would have gotten there eventually, but I would never have managed to do this as quickly as I did. I had estimated 36 months for her to close 12 millimeters of space on both sides. So I was able to get rid of, I told her 30 to 36 months. So, anywhere from 6 to 12 months was cut down from using MOPs. So we're going to switch gears after this slide. So yeah, just in general, patient reactions. Most of the time, they think it sounds scarier than it actually ends up being. They've said only slight discomfort. It's a weird feeling to have someone use a drill between all of their teeth, but it's always worth it in the end. So especially during a time like this, where we're all stuck at home and dreaming of traveling and being on vacation, especially now that Passover and Easter are here. This is a picture I took in Tanzania this summer, and I was fascinated by these animals' teeth. So this is a beautiful lion in the Serengeti. That's my husband and I with that lion right behind us. This was our honeymoon, actually. And this is the Maldives. If anyone can go to the Maldives, I highly, highly recommend it. It's absolutely magnificent. And I was actually reading about a couple who was on their honeymoon now during the coronavirus crisis, and they got stuck at their resort for, I think it's an extra 2 or 3 weeks now that they've been stuck there. They're the only couple on the island, and not a bad place to get stuck. All right, so switching gears to our main focus. So the high frequency vibration, which is the vPro 5 device from Propel. So the benefits of this device is that it reduces pain. So by virtue of vibration, it's increasing blood circulation. We know that the gums and the bone in the mouth have a lot of blood supply. So anything that's going to get that blood to be less stagnant, that blood to move around, is going to reduce pain. It really helps seat the aligners. I like to compare it with to a shoehorn sometimes to patients. As it just helps things slide on, something that's super tight. We want the aligners to fit like a glove. So using something like this that's going to help shimmy it into place is huge. It helps reduce refinements, because when you're using something that's allowing the aligners to fit better, the teeth are going to track better. And reduced refinements, reduced treatment time, reduced root resorption. It increases bone remodeling. I'll go over all of that sciencey stuff in a bit. And retention is something that new studies have come out to really focus on with the vPro. So I love telling patients that this is a device that they're investing in at the beginning, but it's something that they're going to use throughout their retention phase as well. So it's something long-term. It's not just for the duration of treatment. And we'll review those studies as well as we go on. Again, it's an FDA-approved appliance. So really nice to stress that to patients. They like to know that it's a medical device and that it's approved. It's not something they can just buy on Amazon. And it's going to help with tooth movement. We're only using it 5 minutes a day, and it'll increase the predictability of the tooth movement. So a little bit about the science behind vibration. So this has been studied for decades. NASA was the one that started studying this type of movement. And there's historically ongoing research to demonstrate that bone cells are responsive to higher frequencies versus lower frequencies. So there are a lot of devices on the market that do vibration. It's actually the specific frequency that makes a difference. So I think there are some that are available on Amazon. They're not high frequency vibration devices. So clinical benefits of the vPro. So the mechanical seating of the aligner is huge. So we know when we're using aligners that the way they work is by grabbing onto the surface area of the teeth. So we want as much coverage, the maximal coverage of that plastic on the teeth, to get the best grab and to get the best tooth movement, to be as efficient as possible. So the vPro, by vibrating and seating that aligner into place, is going to lead to better fit and better tracking. We know that there's superior performance over low frequency vibration. And I'll show you the study that proves that. You can recapture non-compliance. So if a patient doesn't do well in one aligner and the next aligner isn't seating so well, by using the V-Pro a little more, we can recapture that position and get the plastic to really fit well and snugly to the tooth. And it helps recapture relapse during retention as well. Biologically, what it's doing is it's decreasing bone density with orthodontic force, which is a catabolic effect. It increases bone density increased bone density without orthodontic force, which is anabolic. So this is the paradox, which is a landmark study that came out about a year ago that we'll talk about, which is more bony metabolism. So anabolic being the building up of bone and catabolic being the breaking down of bone. So that has to do more with the retention phase versus the active orthodontic phase. There's increased bone preservation following extraction. And they're doing studies now for implants and using vibration to see if it helps with integration. There's more increased and prolonged osteoclastic activity, increased PDL fibroblastic proliferation, increased osteoblast proliferation. It'll help with aligner accuracy, reduced refinements, increased rate of tooth movement, reduced treatment times, reduced discomfort, again, from helping with the blood circulation, and helps improve the bone quality at retention. And it also minimizes root resorption for all of those reasons that we reviewed, even with the MOPs. So here's a recently published human trial. I'm not going to spend too much time going into these, but basically they all come to the same conclusion that there's high frequency vibration is much better than low frequency vibration. It has more of a biological effect from the fibroblastic level to the osteoblastic level, better root preservation, and we're seeing better aligner tracking, so less refinements, shorter treatment times. So they're all the studies that have come out have been consistent across the board for high frequency mechanical vibration. So this is a study that was done particularly comparing a low frequency to a high frequency. So this is the Cellular device as the low frequency. And they attached both of the devices to a bunch of cell dishes to see how the cells would react. So what they found was that the peak acceleration generated by the V-Pro was 70% greater than those generated by Cellular. So they were watching these cell cultures grow, and the change was massive. So 70% is quite significant. The greater vibration frequency and peak of the V-Pro coincided with more cell proliferation. So again, those fibroblasts and osteoblasts and all the cells within the periodontal ligament. And the difference in the vibration profiles induced by the two devices is striking. So it was a profound study to show the advantage of having a high frequency vibration device versus a low frequency vibration device. And this is another landmark study. This is the one that I mentioned, the anabolic catabolic paradox. So when we talk about anabolic versus catabolic, they're the two sides of bone metabolism that we want to think about. So anabolic is building up and catabolic is breaking down. So in active treatment, we see that there's a high frequency of So the effect of the frequency on tooth movement with orthodontic force is dramatic. So we're seeing a lot more orthodontic tooth movement with less force. So what we're really focused on here, and this is the same pictorial that I showed you at the beginning with MOPs, is that when there is orthodontic force applied to the teeth, the high frequency vibration is going to accelerate tooth movement. Now with retention, we're not putting any force on the teeth. We're holding them stable. We're keeping them in place. So without that force, we're having a different effect on the teeth, and we're having more of an anabolic effect. So more bone density, better build. And I always love to tell my female patients, especially my older female patients, because of the hormonal changes going on and more risk of osteoporosis, using something like the V-Pro in retention is going to keep the bone there, it's going to keep it more stable and maintain that bone density as we age. So this is one of the studies that was done on retention, and it's a really good example of what it can do. So you can see that this patient wasn't too good with their compliance with their retainer, and they had lower anterior relapse, which we commonly see. So patient comes in, all upset, teeth have moved, and now their retainer doesn't fit anymore. So if you look at the bottom image, you can see that that aligner is not at all seated. We have a huge gap. We have, I call it my air bubble, between the incisal edges of those teeth and the actual aligner. And that's causing some pain for the patient because there's a lot of pressure on those teeth. It's not in the right place. The plastic isn't grabbing the right surface area and the right areas of the teeth. And the parents didn't want to pay to retreat the patient. So by just giving this patient a V-Pro and using that 5 minutes a day, it was able to seat a lot better, immediately reduced pain and reduced pressure. And the result, the tooth actually moved back. In 4 months, that tooth moved back. You gain yourself a new referral, and the patient had a sibling who started treatment. So it's one nice thing that you can use to troubleshoot during these types of situations. If you're placing permanent retainers, you don't have to worry as much, but most of my patients get Vivera retainers, and this is something that I love to stress. And even especially at a time like this where I'm not seeing my retainer checks, I will be pushing out my retainer checks later because they're not as essential as my active patients. Not seeing them for so long, I've instructed all those patients to really use their V-Pros at every night. Normally in retention, I tell them it doesn't have to be every night, but during this time where I'm really not following up or seeing anyone, I'm stressing the use of it every night. So we're seeing improved bone quality at retention. And again, that's the anabolic effect, the building up. So the results demonstrated subjects using high frequency vibration had a statistically significant net increase in bone density at the completion of active orthodontic treatment. So a nice little bonus there that this device is going to be useful even after active treatment. So this is just a review slide, again, of all those benefits. So there are so many. It's a device that, at least in my office, I think sells itself. I don't include it with my treatments. I sell it as an additional, and I think 99% of my patients will purchase it. So another study that just shows that with only 5 minutes a day, the V-Pro will improve accuracy with faster aligner changes, so 7-day changes, significantly reduces pain, and will significantly increase those bone remodeling markers in the PDL. So who's a candidate for high frequency vibration? Every single patient, with one caveat. The only contraindication is vertigo. So I do tend to ask my patients if they have vertigo. I think it's important to know because you don't want anything that's going to shake their head, shake their vestibular system, and potentially exacerbate that problem. I have had 1 or 2 patients that have had vertigo, still wanted to try it, and they both could not tolerate it. So take that little pearl with you. So high frequency vibration and braces, we do use it with braces also. In this presentation, I'm focusing more on aligners. But again, all those benefits without the mechanical seating and the physical seating of the aligners are still in play with braces. So it helps with pain, it helps speed up movement, and because we get friction with our wires and our braces, it's something that helps that as well. So it immediately will reduce pain by increasing the blood circulation, will help with some challenging movements by activating the biology and just getting all of those cells to proliferate in the PDL. And it'll help reduce any friction or binding that we get between our wires and our brackets. So in my office, Like I mentioned, 99% of patients in clear aligners tend to purchase it. A few less in my braces cases, but I do offer it to those patients as well. And I always emphasize the better tracking, smoother treatment, more predictable, more comfortable. Patients even describe it as a soothing feeling when they're biting on their V-Pro, and the aligners will fit better, which leads to a better treatment outcome. So vibration devices are totally non-invasive. That's why they tend to sell themselves as well. It's such an easy thing when you tell someone it's only 5 minutes a day. It'll be part of their routine. I always tell patients to use their V-Pro at night, because at night is the longest continuous period of time that a patient is going to be wearing their aligners. So I tell them after dinner, go ahead, floss, brush, put in your aligners, use your V-Pro for 5 minutes. Then go to bed in the morning, go about your day. Most of my patients use it more than once a day. I tell them there's no harm in using it as many times as you want. I even will instruct patients, if there's a difficult tooth, upper laterals tend to be really difficult with Invisalign because they're smaller and they're harder to grab, and they're usually a little bit shorter than the centrals and the canines. I'll even have patients rotate the C-shaped biting device on the V-Pro and bite 2.5 minutes on one lateral and 2.5 minutes on the other lateral to make sure that it's super engaged. So anything that can help with the treatment, anything that keeps the patient on track, keeps the patient happy. So it's totally conservative, the soothing effect. I compare it to power plate technology also at the gym. Everyone loves these power plates that you stand on and they vibrate, or like a shake weight, same thing. It helps recruit all the muscles, all the blood, gets a lot more activity. It's the same thing with the V-Pro, it's just localized to the mouth. It is changing the biology of tooth movement to make things go faster, and just more of a seamless treatment, increased efficiency, and less appointments. They get to take home more aligners each time they come in. So I'm going to review some clinical cases. This is the fun stuff. So we'll go over a crowding case, a deep bite case, a case with severely collapsed arches, a protraction case, crossbite, and open bites. So this patient is a 49-year-old male. He presents to my office, and his chief complaint is his lower left central incisor, which you can see is totally out of alignment. And it's bothered him for a long time, and he really wants to fix it. So one of our treatment options with him, he chose Invisalign as his treatment, and I reviewed with him all the other acceleration options, and he opted to get the V-Pro. So he was using it, I think, twice a day. He was using it every night and every morning. And I told him really to focus on that lower left central incisor. This is his pano. So he's missing lower second molars, no pathology, nothing untoward. And this is him at 6 months for refinement. So look how far that lower left central has moved. We did a little bit of IPR on the bottom, not too much, but just by virtue of using that V-Pro in 6 months, that tooth has moved significantly into the arch where it belongs. He was thrilled. He thought he was done at 6 months. So we did our first refinement, and this was him at 9 months. And I did a total of 2 refinements for him. And here he is at finish. So he finished in just under a year. And he's thrilled. And without the V-Pro, probably would have been closer to 16 or 18 months would be my guess. But just by virtue of the mechanical seating, the physical push of the V-Pro, engaging every tooth into the aligner, getting activation of the biology, it also helps patients remember to place their aligners in. A lot of patients will say they always forget. When they have a V-Pro, they tend to not forget. It's one more thing that they see in the bathroom, plugged in, and they remember. So this is the crowding case. So yeah, so in less than a year with 2 refinements, this is the end result. So we had about 7 millimeters, 6 to 7 millimeters of crowding on the lower arch that was resolved in 11 months. So here's a 13-and-a-half-year-old girl. She comes in, she's got moderate crowding on the lower arch, but what I would say is her biggest challenge is that she has a deep bite. We see very little of those lower incisors. She's about 80% deep bite. And we've got a lot of bite opening to do, rounding out of the arches. She's a class 1 on both sides. So V-Pro. And here are her records. So here she is at 7 months in refinement. So now we're at probably 50% deep bite, but we've gotten rid of most of the crowding on the lower. We've really rounded out the arches. She's looking a lot better. And here she is at 10 months, so 4 months later. Look how full her smile is on that top right versus when she started. So we got a lot of expansion. She's at about 25% bite now, overbite, much better results, good alignment, healthy smile, patient is happy, as you can see by the smiley face stickers that she came in with on her face. But the V-Pro really helped. This mom in particular told me that she was really suffering at the beginning with the pressure from the aligners, and she was using that V-Pro even in the car. She would plug it in, it has a little USB, and she found that it helped her so much to even get through the day on her way to school. So she really benefited from using the V-Pro. So here we have a 60-year-old male, and he's got really collapsed arches. So he is class 1 right and left. Sorry for the blurry photo on the lower left. But he's got severe crowding, both upper and lower. He has a class 2 div 2 appearance. You could see by those retroclined upper incisors. He's got arch collapse on both sides, on both arches. So we're going to use the V-Pro. Here's his pano. And we treated him with Invisalign. We had some difficult movements, so I did do selective propel for him. We had to expand a lot. And the goal was to finish faster and control the precise mechanics. So here he is at less than 3 months. And look at the change. I mean, look at the lower canines. Look at the upper arch. This is a dramatic change in less than 3 months. I think this was 85 days. So looking at the initial versus the end, you can see how, sorry, the 85-day mark. You could see how much expansion we got, the bite opening. Look at the canines, look at the laterals. So tons and tons of change. The V-Pro was huge because he's not actually biting on all his teeth when he closes. So we want to make sure that all those teeth are getting engaged into the aligners. So just looking at that change is dramatic and profound. And here he is. I did repropel that lower right canine. Don't mind all the teeth staining on his attachments. I am very attachment heavy in these cases. And here he is at 13 months. At 13 months, we finished. And he's got nice rounded out arches, good overbite, good overjet, and a thrilled patient. He's got better lip support now. Now moving on to a protraction case. This is a difficult case. This case was referred to me by an oral surgeon where the upper right second molar was a hopeless prognosis and was extracted. And we used the V-Pro for him with clear aligners. And here's his pano. So looking at that upper right second molar, you could see cavitated. Even the upper right first molar doesn't look great, but that guy had a hopeless prognosis and was extracted. So the oral surgeon asked me to protract the third molar so that he wouldn't have to take that one out and save this patient from an implant. So these are my goals. And here he is at 2 months. So the V-Pro was huge for him, and I did do selective propel for that protraction. So at 2 months already, we have significant change, starting to get some alignment. Look, we can see that third molar now moving into place. Here he is at 3 months. So at 3 months, again, I had a 12mm space on that upper right. Huge change, huge movement. Really closing that space up. This is 6 months. And here's our final at 14 months. So this case normally, again, would have been a 2-year case, hands down. With both, this was definitely a adjunct with MOPs to close that space, but V-Pro all day, every day is going to get me where I want to go much faster. And again, here's that profound change that you can see in 14 months. So opened up a deep bite, unraveled crowding, protracted a molar. All right, moving on to crossbite. So this patient presented, you can see also arch collapse. He's got a crossbite. His whole right side is in crossbite from first premolar all the way back to second molar. Crowding and a deep-ish bite in the anterior. I don't think he's biting properly on that center shot when you look at the buccal shots. So treated him with aligners and a V-Pro. And we did do some propel for him as well, because here he is 52 aligners in at 4 months. So he definitely got propel too. And again, dramatic change. These patients tend to be my best referrals because they're getting such great progress so quickly. So rounded out the arches, fixed the overbite, fixing the crossbite on the right side. Here he is at 8 months. We still needed more settling, so I added some buttons for some rubber bands to help with the vertical change on the right side. But again, V-Pro, V-Pro, V-Pro. And here's the final at 10 months. So we settled the case, beautiful rounded arches, no flaring of the teeth. The teeth really translated nicely to get that expansion, and a really happy patient. And the last case I'm going to present is an open bite. This patient came to me. You can see he has a permanent retainer on the lower. So he was a relapse case, a tongue thruster, and we decided to treat him with aligners and the V-Pro. So any open bite cases, I really like to stress the V-Pro. They're not biting on all their teeth. They really need that extra TLC that the V-Pro will give them to get the aligners to settle in and hug all those teeth. So stress the V-Pro to him. These are his records. So compliance, 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 the most important thing. This patient was super compliant because when he came in at 3 months, I was shocked at the change that we had. Yes, I was using vertical elastics. And again, he's got tons of attachments. I don't know if you can see them, but every tooth, I think, had buccal and palatal for the anterior canine to canine, trying to close this bite and discourage the tongue at the same time. But we got a huge change in 3 months because he was compliant and he used his V-Pro. Here he is at 7 months. Again, we're just refining movements, getting everything nice and perfect. And here's the finish at 9 months. I never thought I would be able to finish a case like this in 9 months with Invisalign. But with the V Pro, huge, huge game changer. And just by virtue of making sure that, again, like he's got small laterals too, and making sure that he was engaging all of those, he's one of those patients that I told him, you've got to rotate that V Pro, you've got to give each of those laterals extra love. You got to make sure that every single tooth is getting engaged by that V Pro. And this is just a highlight of that final result. Just looking at the change, that dramatic change in 9 months to close an open bite. So again, everyone's a candidate for the V Pro. The V Pro can only help. And all of its advantages, I mean, patients, they just jump on it. You really want to stress the reduced soreness and the biological activation leading to faster aligner changes and more predictability. It's definitely something that is a practice builder and that patients will never complain about. No one's ever complained about their V Pro. They love it. It just makes things better. So benefits of high frequency vibration with combo use. So I do use it with MOPs sometimes, just for, again, like that adjunct for maximal control, predictability, compliance, and the profitability definitely doesn't hurt your bottom line. So 5 minutes a day is all that you need. And that device is good forever, even with retention. And that's it. That's it for today. Thank you guys for your attention and for tuning in. And let me know if you have any questions. Hang on, I'm just opening up the questions. Oh, okay. So question number 1, what do I charge for MOPs and for the V Pro? So the V Pro is $550 in addition to my case fee. And for MOPs, I typically charge $400 a quadrant. If they're doing full mouth, it's $1,200. The nice thing with MOPs is, even though I don't accept assignment, I do submit claims for patients, and most of the time they do get reimbursed for MOPs. I don't remember the code off by heart, but it falls with Ontario, and your Propel rep will definitely know what it is. So they usually get about $1,000 back for MOPs. Somebody asked about the effectiveness of using just vibration and not MOPs. So vibration to me is my #1 go-to. MOPs is just a nice thing, again, for really difficult movements. So it's really important for me to use MOPs, especially protracting a tooth. So that molar case, like closing a 12mm space, protracting a 3rd molar, I would never be able to do that in such a short amount of time without MOPs. That's when MOPs really plays a game-changing role. But, you know, again, it's something nice to offer patients who are really concerned with time, because when you do full mouth and they're changing every 3 days, their aligners stay clean. They don't complain about that, and they're just flying through their aligners and they're really happy. So I think MOPs and V Pro are both huge practice builders, but the V Pro is going to be my #1. Do most of my patients get both MOPs and V Pro? I would say V Pro is definitely way more, because my teens get V Pro as well. Most of my adults will want MOPs, again, gauging them, making sure they're not too anxious, because of that huge difference in time, the 3-day changes. But it does really depend. When you have a crossbite, to have them wear their aligners while eating? No, I don't. I tell them to take them out. I find that when patients eat with them in, they end up staining their aligners and getting upset. So I just focus on the 20 to 22 hours a day with their aligners, but I don't have them wear their aligners while eating. Next, for the complex cases that you are using just Propel, no MOPs, do you decrease aligner time? What is your decision tree for deciding when patients switch aligners? So when I'm using just VPro, I definitely decrease into 7-day changes. Most of the time with my adults, I'll start at 10 days, not 7 days. And it's always going to depend in terms of my decision tree for when patients switch aligners. It's really going to depend on what kind of movements, what's the problem, what malocclusion is it, and what kind of a patient is it. So I usually start at 10 days for most patients, and then I check how they're doing after 4 or 5 aligners and then go from there. If things are tracking really well, I might reduce it. I let my patients gauge as we go. I give them a range. And if they're, I say 8 to 10 days, and if on day 8, the next aligner fits, then go for it. Why didn't you consider the bolt-in in the upper laterals? I'm guessing you're thinking of that last case, the open bite case. I did. I always mention it to the patient, but if it doesn't bother them and they don't want to do any restorative, then I just go around it and treat them as best as I can without it. So often doing more IPR on the lower. And again, in an open bite case, IPR is going to help me with bite closing. So that's something I probably would have programmed in anyways. What's next? A lot of repeat questions. Did he end with bilateral posterior open bite? I'm not sure which case you're talking about, but definitely not. I check every final case with shim stock to make sure that they're biting properly. Sometimes I'll trim off the posteriors of the last aligners if it's marking with articulating paper, but not with shim stock, just to let them settle a little bit more. What type of clear aligner would you recommend? I use Invisalign. Invisalign is my gold standard. I have used 3M's Clarity system. I don't like it as much. So definitely I'm a heavy Invisalign user. How much of an open bite can you close with these devices? I've closed 4 or 5 millimeter open bites with Invisalign and VPro. So again, the VPro is huge for my open bite cases. I almost force those patients to get it because it's going to make such a huge difference. Do I have any criteria putting on attachments? Yes. But that's the biomechanics, and my attachment protocol is quite complex. I don't use optimized attachments. I use my own conventional attachments, and I use my tooth movement table in Invisalign and 3D controls to determine how much tip, how much torque, rotation, what needs to be done. And then I design the geometry of my attachment depending on each tooth movement. So it takes me a while to do my clean checks. In terms of how fast I have patients change aligners, so with VPro, it's normally a 7-day change. With Propel, with MOPs, I do 3 days for the first 6 weeks, 4 days for the 6 weeks after, and 5 weeks following that. Does MOPs also help with distalization of molars? Yes. Yes, MOPs will help, especially molars, 4-rooted teeth. I mean, MOPs is huge for those big, heavy teeth that need a lot more movement. That's your game changer. Someone asked for MOPs training. I would suggest contacting your Propel rep. And yes, they will give you training on a skull. Contraindications for MOPs. I would say anyone with a bleeding disorder, I wouldn't really feel comfortable treating. I always ask them for what medications they're on because I don't want patients leaving my office bleeding. I'm an orthodontist. I'm not used to doing surgeries anymore. So I would want to stay away from that. There is a list of MOP contraindications. You can find that, I believe, on Propel's website. But in general, any patient in good enough health to go through with orthodontics with elective dental care should be fine for MOPs. Does MOPs work for rotations? Absolutely. Do I charge less for treatment if both V-Pro and MOPs are used since the treatment time is less? I do not. It ends up being more. So I actually bundle my MOPs and my V-Pro together for patients. So if they're doing full mouth MOPs plus the V-Pro, it's $1,500 instead of $1,200 plus $550. But otherwise, I'm giving them a gift because they're finishing much, much faster. If treatment time is within 1 year, is the patient paid up in full at the end of treatment? Sometimes yes, sometimes no. My office manager / treatment coordinator, she will determine that with patients. If they need us to stretch treatment out to 18 months in terms of payments, then we're happy to oblige. I never want a dental problem to be a financial problem for my patients. And we do retainer checks for a full year. I do every 3 months for a full year. So I'm still seeing those patients come in. I've only used the V-Pro on 2 patients and did not get the desired tooth movements. What would you suggest? So for that question, I think that has nothing to do with the V-Pro. That likely has to do with either your attachment protocol or the patient wasn't compliant. The V-Pro should only help, and the V-Pro is not going to make the teeth move without the proper mechanics designed within the aligners, which includes the attachments, right? Remember how you need the surface area of the teeth to be totally hugged by the plastic. That's the big difference. Invisalign pushes on teeth and wires and brackets pull on teeth. So we really need to make sure that the entire tooth is engaged in the plastic. So if you have that and you have the proper attachment protocol, everything should move perfectly with a V-Pro. I do not use Chewies because I use the V-Pro almost exclusively. What kind of software did I use? I'm not sure what you mean by software. I don't know what you're asking for. If you can clarify that. Oh, type of material. So my retainers are Vivera, not Zendora. I use Vivera and Invisalign. Thickness of material for leveling and aligning. That's going to be Invisalign's plastic, which I believe is 0.2 millimeters thick, both upper and lower. So I always tell patients they're going to feel the 0.4 millimeters that they're biting on. Could you please mention articles, talk about selection of attachments? I can't recommend any articles in particular that talk about attachments. I was taught that through the master's course with Invisalign. I think it's not being offered anymore, and I'm pretty sure it was only for orthodontics, but I would highly recommend contacting your Invisalign rep and asking your Invisalign rep about any continuing education courses where they can focus on attachment design, because that is huge. That's going to make your life so much easier. You do a lot of work on the back end, spend a lot of time with your ClinChecks designing your attachments as per the particular movement that's needed, and then add in your V-Pro plus or minus your MOPs, and you will get there. You will get the result that you want. And I think that's it. All right, thank you, everyone. Stay safe, stay healthy, and thank you for listening.